Good day everyone, I am Michael, the moderator for this webinar. I welcome everyone for today's webinar, which is New HIPAA Compliance for Website and Tracking Technologies, Social Media and Patient Reviews. It's a great pleasure for me to introduce our presenter for today, Paul R. Hills. Paul R. Hills, JD, is widely recognized for his ability to explain HIPAA rules clearly in plain language. Paul is an author of all content in the HIPAA e-tool. I would now like to hand over the floor to the speaker. Over to you, Paul.
Thanks very much. Hi, and welcome to all. So we're going to talk about HIPAA compliance for websites and social media. Most recent guidance involving tracking technologies, and we'll also cover patient reviews. You have received handouts, and those handouts have clickable links to all of the resources that I am using to create this educational webinar. And they really focus on the enforcement activities involving tracking technologies by the Federal Trade Commission. And that's very important for you to know to protect your organization, whether you are from a covered entity, a HIPAA covered entity, or from a business associate, a HIPAA business associate that provides patient engagement tools to HIPAA covered entities. So what are we going to cover? First, we're going to look at why this is important. Then we will look at the HIPAA rules for websites and social media. And those are websites, those websites that are subject to the HIPAA rules include a covered entities website. And also we'll look at a covered entity social media website. And we will provide two very simple website safeguards. Then we'll look at this brand new, really what is new is the guidance that's been given, and we'll look at how to avoid tracking tech liability. And these tracking techs are cookies, a metapixel, Google Analytics that are on covered entity websites. And then we'll look at the HIPAA rules covering patient reviews, both how patient reviews can violate HIPAA, and again, some very simple safeguards to protect you from violating HIPAA when you, with respect to patient reviews. And I want to give you some quick alerts. These are links. Now, in terms of patient reviews, I'm going to show you here an enforcement action. And up in the upper left-hand corners, you can see a link that will take you directly to the HHS website where you'll find this press release. Again, here are some links to articles on that website that I mentioned earlier. So why is it important? Well, one thing is that the violations are dangerous, and that is important to your patients if you're a healthcare provider, or your insureds if you're a health plan that are full of violations. And you might say, well, if they can do it, this is a new slide that I added this morning, and it's the Federal Trade Commission, the FTC, and that is a link to their webpage about medical identity theft. Protected health information is really the gold standard for medical identity thieves, the identity of a patient and the identity of a provider. And in this webinar, you will see how easily one can find both the identity of a patient and the identity of a provider on social media, on patient reviews. The criminals use what they call social engineering, and they attack people of all ages and all walks of life. That HIPAA applies only to covered entities and business associates. HIPAA rules for websites and social media. Let's take a look at the HIPAA rules that apply to websites. What about a social media website? Links to federal laws that define a website. That leads us to the simple safeguards. And safeguard number 1 is that your notice of privacy practices must be prominently posted on your website that I took off the web, where the notice of privacy practices is prominently posted. And that's extremely easy to do. Now, here's an example of the second safeguard. So it raises 2 questions. What is PHI? And what is a valid HIPAA authorization? Well, the identity connected to the provision of healthcare is protected health information. So here are all of the identifiers. What is a valid HIPAA authorization? Well, it has 6 specific elements, 3 core elements, 3 required statements. They're all explained. If you click on that link, they're just listed out. Safeguard number 1, notice of privacy practices, prominently posted. Safeguard number 2, before posting, get a valid HIPAA authorization. So let's take a look at this new HIPAA website liability, and it has to do with tracking technologies. And OCR has a description, so let's look at how to avoid tracking tech liabilities. And then when it gets to your risk management program, so let's take a look at the HIPAA rules covering patient reviews and how patient reviews can violate HIPAA. The American Medical Association says exactly the same thing. Patient review safeguards to protect your organization. Do not respond online to independent reviews. So in conclusion, we've looked at why it's important, what the HIPAA rules are for websites and social media, and 2 simple website safeguards. We've looked at this new website liability, tracking technologies. So I have used up my entire hour and a half. So I want to thank you all for your attention. I want to thank you all for your attention and wish you well in your HIPAA compliance program. Michael, why don't we just go ahead and wrap this up?
Thank you, Paul. So that does conclude the session for today. Thank you everyone for participating. You may all disconnect now. Have a great day ahead. Bye-bye.
Bye-bye.